Good afternoon, everyone. I'm Lindsay Goldfarb, Director of Healthcare Education, and on behalf of the Massachusetts Health and Hospital Association, welcome to today's webinar, Mobilizing Patient Social Supports to Improve Health Outcomes. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, please type them into the chat box. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the slides along with a brief survey. I'd also like to take a moment to thank MHA's 2021 sponsors for their support in underwriting today's webinar, which is part of a series we're doing to bring experts to our members to help address timely issues relating to the COVID-19 pandemic and other hot topics in healthcare. Without personal social connections in a hospital or during recovery, a patient can easily become isolated and lonely, which can lead to serious health complications. Social supports are an integral tool in improving patient outcomes, and today we'll be discussing some of that during the webinar. Now I'm pleased to introduce our speakers for today. Tia Newcomer is the CEO of Caringbridge. She ensures that all operations contribute to the Caringbridge vision, a world where no one goes through a health journey alone. Alicia Wierenga is the Senior Director of Patient and Family-Centered Care at UMass Memorial Medical Center. She has a passion for changing how we care for patients and also a passion for caregivers. And Billie Adler is a Project Coordinator for Patient Experience and PPAC Staff Liaison at UMass Memorial Medical Center. She's passionate about advocating for patients and families and improving the patient-family experience at UMass Memorial Medical Center. And we're so delighted to have you all here with us today. So without further ado, I will now hand it over to Tia.
Thank you, Lindsay. Really excited to be here today and talk to this esteemed group of professionals. So let's dive in. I'd love to give just a brief overview of Caringbridge. If you could go to the next slide, please. Take us back to 1997. The internet was just launched, and Sana Mering, the woman that's standing in the purple shirt, had friends that unfortunately had a premature baby Bridget. She was in the NICU in pretty critical condition for about a week before she passed away. But during that week, her best friend, shown here, asked her to communicate updates about the family and baby Bridget's health. Sana took on that honor, really, of communicating with family and friends, which was quite a large network. And she found after her second call of 40 minutes, crying, absorbing other people's emotions while she was handling her own emotions, she thought to herself, there has to be a better way. And something you should know about Sana, and this goes back to 1997, is one, I just want to point out that Mark Zuckerberg was all of 13 years old. So this was before Facebook, before social media, before any of the things that we consider normal parts of our lives. Sana had this idea, and she went to her basement and coded Caringbridge. And a woman entrepreneur and a woman in STEM that had this vision of how do I make this easier on people going through a health journey, both as a caregiver or a patient. If you go to the next slide. And this has led to our very strong, almost 25-year-old vision and mission. And Lindsay mentioned it at the top, our vision is a world where no one goes on a health journey alone. And we are passionate about our mission, which is we're building bridges of care and communication and really providing that support and that community around someone, their whole family, really. Again, caregiver is about 60 or 70% of our authors or people who start sites, with 30% a actual patient. So it really does rally a community around people going through a health journey. If you'll go to the next slide, please. Just a little bit about Caringbridge. I mentioned we have almost 25 years of impact based on that vision that Sana had, again, in 1997. Today, almost 1 in 7 people in the US use Caringbridge for a health journey. And you can see that the resources that we provide, and this is all free, private, all have been growing 3 times over the last 5 years. And that's a pretty impactful statistic when you think about the number of people going through health journeys that need resources and connectivity. If you'll go to the next slide, please. An important note is we are a nonprofit. So we are funded by the people who use the platform, and that has been from the start. 90% of the $11 million of our nonprofit comes from individual donations, most of those who have used or experienced the power of Caringbridge. So it's a testament to what we do and why we get up every day to continue to spread the word about Caringbridge. You'll go to the next slide, please. We have many user conditions. I will tell you the majority of them have been around severe or longer term issues that people are going through, whether it be cancer, strokes, surgeries, neurological, infant, childbirth. We do have a lot of people that use Caringbridge for communicating about those instances. And what we saw actually in the pandemic is that COVID became one of our top sources of people tracking their health journey, particularly because, as we know, people were completely cut off from not only their immediate family, but from their community. And so we'll talk a little bit later about what happened with nurses and doctors really embracing and bringing Caringbridge into the devices into their hospitals to ensure that their patients could communicate, or that the care staff could communicate with the families outside of a complete shutdown of outside in visitors. If we go to the next slide, please. So we talked a little bit, Lindsay leaned in a little bit to social health outcomes. And when I think about that 25-year foundation of really being able to support people through a health journey, there are some pretty impactful social health outcomes. We know that when people journal, it helps them through that journey, not only as patients, but as caregivers. And you'll see on the left a word cloud that we recently conducted some research on, that people feel supported and connected. And why that's important is that we know there's plenty of statistics out there, but I'll cite a couple that, for example, patients with ovarian cancer lived longer when they had greater social attachment, and that extends to many diseases and or journeys of health issues. And we also know that patients with strong social support have shorter hospital stays. So it not only improves outcomes, but it shortens those stays within hospitals. So there are some really great outcomes of being able to connect people in a social network. Next slide, please. I talked a little bit about how we supported people through the COVID pandemic, and we still are. One of the other things, outside of just offering that ability to connect from inside the hospital when no one could come in, is also we launched some services to help people as they were going through that health journey. One of them was with our partner Shipt, where we had grocery delivery, so that anyone that knew a patient could support them through their journey. And we know that that instrumental support creates relief for the family, and it engages the community. And so Caringbridge is that one-stop shop where we allow people to come together, whether it be to deliver groceries or to support them through words of encouragement, all the way to saying, hey, can I help you walk your dog or deliver a meal? And all of that is contained within our Caringbridge service. Next slide, please. So why Caringbridge? And then I'm going to go through very briefly what Caringbridge looks like if you've never experienced anyone or interacted with the website or our app. Caringbridge does focus on the user's health, and it allows people to control who sees their site. So it's very high on privacy, and it can range from anyone can see it all the way down to only these few people can see it. We have no advertising, we never sell data, and again, we're a nonprofit and this remains a free service. And we have a ton of inspirational stories, links to books, helpful tips and advice. So it's also a source of support and research that we've aggregated into the website. Next slide, please. So a couple of quick snapshots if you are on Caringbridge and you are either starting a site or interacting with the site. Here's where you can see that it's easy. It's kind of one click, and we're committed to that privacy and control. Next slide. And it's all in one platform. So here you can see it's a journal page. People can share their story. We do have the ability to integrate video via YouTube, so you can do vlogging if you'd like. If someone's in the hospital, we see a lot of that from hospital bedside. And they can post pictures. There's ways to help. Again, I talked about the planner of being able to coordinate any kind of needs that someone going through a health journey needs, from food to walking the dog to even taking people to appointments. Next slide, please. We talked about journaling, and that is probably that is the foundation of Caringbridge, is the ability to share all in one place, easily and quickly, updates on your health journey, whether you're a caregiver or you're a patient. And this has been one of the biggest benefits, as I talked to earlier, for health outcomes, is that ability to share quickly in one place to your community, whatever size that is. Next slide, please. And a little bit about our ways to help. We have a lot of outside partners that help us, from GoFundMe to Meal Train to shipped grocery delivery. So again, all a one-stop shop where people can get support from their community as they go through the health journey. Next slide. Healthcare professionals are critical to what we do. We find that, and you all experience this every day, at point of care or at point of need is when Caringbridge is shared the most. And that is when most patients need it the most, is at the point that they find out they're either going to be entering a cancer journey, have just suffered from a serious injury. If they can be given this at point of care, it is very powerful. And we know that caring, actually, this extends out of any of my healthcare industry experiences. People trust their healthcare professionals, from nurses to doctors to any staff that is interacting with them. If Caringbridge is part of that recommendation, people trust that recommendation. And I'll just end with, it's free. Again, this is a smattering of the health partners that we, again, a small subset of who we partner with around the nation today. Next slide. And I want to offer up, and we'll end to show how you can actually integrate Caringbridge into your hospitals easily. But we do have a trusted patient resource. I will mention that if people are having issues with the Caringbridge site, we actually have a wonderful team of people that answer the phone, usually on first or second ring, and emails and chat. But we have a trusted partner that will help anyone that's having difficulties using the service. So that's a point of differentiation, and takes some of the burden off your staff if anything would to come up that is not working. And we know that this also can lower hospital call volume or patient inquiries based on that help that we provide. Next slide, please. I'm going to turn it over now to our partners at UMass Memorial.
All right, can you hear me? Perfect. Well, thank you for giving Billie Adler and I the opportunity to speak on behalf of UMass Memorial Medical Center about how we implemented Caringbridge. So why did we choose Caringbridge? There really are three reasons for why we decided to bring Caringbridge to the medical center. The first reason was, as we were going through the pandemic, we were looking for ways to find structures so that our patients and families could communicate with one another. With our visitor policy changing in ways we never imagined, we found that Caringbridge gave our patients and families a social platform and the social support that they needed when isolation and loneliness were some of our top concerns. We did have a strong virtual communication program, but this was one other way for our patients and families to be engaged and build a social network. The second reason was our PFAC members had used Caringbridge in the past and spoke highly about how the tool improved their overall health journey and overall communication. We started to look into Caringbridge prior to the pandemic, but the pandemic really did accelerate our efforts. Ultimately, PFAC sponsored Caringbridge during a Zoom call, and we started with our journey. It was really important for our PFAC members to bring Caringbridge to the medical center. And lastly, at UMass Memorial Medical Center, we are moving towards a culture that is patient and family centered. We found that Caringbridge would help us carry this out. So how did we get the ball rolling, especially during a pandemic? So during the pandemic, we were busy creating our 5-year roadmap for patient family-centered care. And we found that it was really important to put Caringbridge on the roadmap and to make it part of our strategy. We put it under patient and family engagement improvement work to help excel the core concepts of patient and family-centered care. With the support of our executive patient experience team and others, we created a strong communication and implementation plan. The goal was to engage our patients, families, and caregivers on what Caringbridge was and the value it could have for those going through a health crisis or on a long health journey. So I'm going to pass it over to Billie Adler, who will talk you through how we implemented and our communication plan and how we partnered with Caringbridge.
Thank you, Alicia. Once we established our partnership with Caringbridge, we rolled our sleeves up and developed a plan to publicize the platform amongst caregivers, patients, and families. We introduced and launched Caringbridge here at UMass during National Patient Experience Week this past April, when our department sponsored our medical center town hall. At the outset, Caringbridge supplied us with more than 1,000 brochures in both English and Spanish, which we circulated to every nursing unit in the hospital, and we created flyers for nurse leaders to post in staff areas and share at their huddles to familiarize caregivers with Caringbridge so they could, in turn, recommend it to patients and families. Caringbridge brochures are available in our lobbies, our clinics, in the ED waiting rooms, and we've distributed them to our social work teams, our chaplaincy, and our child life specialists in pediatrics. As Alicia mentioned, during the pandemic, we created a virtual space to help our patients cope with isolation from their loved ones. Our patients can now use a hospital iPad to stay connected to their support network, and the Caringbridge app has been installed on each one. Caringbridge's Zoom feature makes it easy for our patients to connect with family and friends. Rolling out Caringbridge internally included featuring an article about it on our system-wide intranet, sharing details about it at our patient care services huddles, and it has been championed by our medical center president. Our care coordinators are now using Caringbridge Post-it notes, attaching them to discharge papers so that along with brochures, information about Caringbridge follows our patients from hospital to home. Moving forward, we'll be working to broaden awareness about Caringbridge with a week-long system-wide screensaver campaign in November, and we'll be working with our quality informatics team to connect Caringbridge to MyChart. With the support of our marketing and communications team, we'll be leveraging our social media channels to further publicize this vital means of social support for our patients and families. In closing, I'd like to thank the Caringbridge team with a special shout out to Christy Thibodeau for helping us realize these accomplishments. Developing a partnership has been truly rewarding, and we're looking forward to our continued success together. Next slide.
Here's a quote from our president, Dr. Michael Gustafson, and he says, "One of the most devastating aspects of the pandemic was how necessary visitor restrictions impacted the pivotal relationships between patients, their loved ones, and caregivers. We know that patient family-centeredness is at the core of high-quality, optimal care, and while we always want loved ones present in the hospital environment, Caringbridge allows us to ensure that this critical connection remains intact, regardless of any personal or societal barriers that may exist in the future. So I thank Dr. Gustafson for giving us that quote. Next slide.
All right. Thank you, Alicia and Billie. You guys have been phenomenal partners, and pioneering this, need at point of care, and particularly during COVID, was a huge, huge win for our patients. So thank you. So how to share Caringbridge? There's really 3 opportunities as you all think about where and how do you integrate Caringbridge into your patient support system. One is at bedside. I think Billie and Alicia just talked about how they integrated that into their iPads and other digital mechanisms. The second is hospital touch points, so links out and/or integration into your own hospital websites. There's a lot to do there, from start a site to looking at brochures, videos, articles. All of that can be accessed and linked out from your own hospital touch points. And I think most importantly, and we talked about that at point of care, outside of that bedside, there's digital and print, particularly print, that can be handed out with materials when talking with patients. And that seems to be the most impactful. We can get information, again, out of those things that are trusted from nurses and doctors. That folder that's handed to a new patient is probably one of the most impactful places that people know about Caringbridge. Next slide. So thank you for letting us talk about this tremendous journey we've been on over the last 25 years, and most importantly, how this last 2 years of the pandemic have shown that people still need this social support system more than ever, and that Caringbridge can be part of that social support. I look forward to you all asking questions. We've got a great team here. As the shout out from the UMass Memorial team alluded to, that can help you on anything to integrate into your hospital systems. So we look forward to helping us achieve a world and our vision where a world that no one goes through a health journey alone. I think we're going to open it up for questions now.
Yes, it's time for Q&A. And just a reminder to our audience, please type any questions you have in the chat box. And I know we've already seen some coming in. So first off, I just wanted to say thank you all so much. An incredibly engaging presentation. And we all know, especially during the past year and a half, this issue has been incredibly spotlighted, that social connections are more important than ever. So I'll just kick off the chat by asking one of the questions that's come in: has there been any work in the behavioral health sector?
I can start with the Caringbridge point of view. It's actually one that we're definitely looking at integrating more so, especially as mental health is becoming a huge urgent need within the US. It has been there, but I think highlighted even more as we've gone through the pandemic. So we do have integrations with the Mayo Clinic and some clinical partners that are starting to look at, for example, in the dementia and Alzheimer's space, how does Caringbridge support both as importantly, caregivers through that journey, because the mental health burden on someone that is caregiving is quite large. And we've also just partnered with a group called Archangels, who is also looking at caregiving in the United States. In fact, they just released a CDC study in partnership about I think it's called the sandwich caregiver generation, where they're taking care of their parents while taking care of their children. And that, I think it was over 52% have suicidal thoughts. They could be passive and or unfortunately pretty severe. And so those are the type of partnerships that we have just started embarking on to continue to look at how does Caringbridge help that journey and the outcomes of mental health space. So open to any and all other partnerships, because I think it's a very important space to be in.
Thank you. And I did just want to share a nice sentiment that came in through the chat as well. This person noted that they were unaware of Caringbridge until earlier this year when a friend's family used it to keep her network informed in her cancer and then hospice journey. It was tremendously helpful, keeping folks informed without inundating her caregivers. So just a sentiment that shows Caringbridge in action. Another question here, has this service been tested with individual providers?
Yeah, I saw that in the chat room. I wouldn't say it's been tested, but it's absolutely used by individual providers. So it doesn't matter if it's hospital system or an individual doctor. I think the key point is at point of care is the most impactful, important sharing of this resource.
And a good question, I think, for the UMass team. What would you say is the first step in getting buy-in within your organizations to roll out Caringbridge?
Truly having a champion that's passionate about it. Definitely, I'd have to say, I mean, I was very passionate about it, but Billie was very passionate and really also having a plan. I think it's something that you just can't say we're going to do. I think what helped us is we had a plan that we executed on. And when it came to the communication and how we were going to roll it out to the different inpatient and outpatient areas. So that's the tips I would give.
Billie, any thoughts?
I echo that. I actually had Caringbridge 11 years ago. So I came to this organization with a passion for Caringbridge because it helped me when we were just starting to use smartphones, and hardly even that.
That's great. Thank you. Well, I think we've covered everything that's in the Q&A. So any closing words? All right, great. Well, I did just want to say again, thank you so much to our speakers for today. Thank you all so much for attending. As always, please feel free to check out the MHA website for upcoming educational programs. For all attendees, we will be sending you a recording of the program along with the webinar slides, along with a brief survey for additional topics that you'd like to hear about. So again, thank you all so much and have a wonderful afternoon.
Thank you.
Thank you.